changed is the old temperature guidelines used to be 80 to 104 for hot and 55 to 67 for cold. And that's what's on your handout. You're going to cross that out because the new guidelines are a little
colder,
higher and colder, hotter and colder. So your Bellinger text recommends 99 to 110 for hot and 41 to 68 for cold. So their research is on a bigger range. Cameron says 100 to 111 for hot and 50 to 64 for cold. What I would tell you is I picked the common numbers, so 100 to 110 for hot and 50 to 64 for cold. If you only wanted to remember one set of numbers, those are equal in both. Does that make sense? So we're going somewhere between 50 and 100. They're easy to remember, you know, because otherwise you can get caught up in all of this difference. But when we're choosing the temperatures for our pools, we're either going to desensitize some nerve endings, we're going to try to decrease edema, we're trying to increase circulation, something, and we're going to pick the ranges based on that.
So no matter what our water temperatures say in here, like we've got
the water temperatures stick,
okay.
But there's a box on contrast
Okay.
that said those other ones, the only thing that we're changing is the contrast based on new research. So if you look
Okay.
under the contrast bath one,
Yep, I got it.
yep. So
Cool.
this is what I want you to have written in there now, okay? So if you just remember somewhere between 50, 55 and 100, 110, you know, you're doubling it. You use larger ranges if you're trying to increase circulation. That makes sense, right? So we'd want to go from for the hotter and the colder, so maybe 110 and 64, I mean 50, if we're trying to increase circulation. If we're trying to, if it's a subacute problem and they have some edema, but we're trying to get the circulation going, I might go on my lower sides of both. So maybe 50 and 100. Does that make sense? If I'm just trying to desensitize them and let them get used to the difference of hot and cold, I might go my higher range of cold and my lower range of hot. Okay? So a lot of it's just common sense, but I want to make sure that you're very clear on these new recommendations for temperature. Okay?
I never figured out, you know, that the hot was 80, and what is our normal temperature? Our normal temperature is 96, and so 80 doesn't feel warm.
Yeah. And
80
so,
is cold.
and it was that way for many years, but now they've just increased it to the higher end of what they used to say. So just make sure that you understand that. The other thing is you're always going to start with the hot tub and you're going to end with the hot tub. And so you're going to have them submerged in the hot bath for 3 to 4 minutes, and then they're going to go into the cold. And I can tell you, if you go from 110 degrees to 50, it feels really cold. So warn them. Let them stick their hand in it first, or their other hand in it, or their other foot, whatever they're going to do, so they know what to expect. We're trying to decrease pain and cause them to relax and get circulation. What happens if you stick it in the cold and you go,
yeah.
You just shunt everything and we're going to go backwards. So you want to definitely warn them. Only 1 minute in the cold. 1 minute and 50 degrees feels really like a long time. And so have the timer right there so they can watch it. Whether you sit in front of the clock or you have a stopwatch there or something. Because then they're going to go back into the warm, and they're going to end in the warm. We're going to do about 5 cycles for a total of 25 to 30 minutes. This is really important because there's research in both of your books presented that you don't get the circulation changes unless you do it at least 20 minutes. So that's why they're recommending 25 to 30. Okay? So about 5 cycles back and forth, starting with hot and ending with hot. It is a very easy treatment. You're going to inspect the skin. You're going to review your heat and cold contraindications and precautions. The same thing you did with moist heat and your Copex. Okay? We don't have a lot, but we're looking at, is there a circulatory problem? Is there a risk of cancer metastasis? Is there a type of peripheral vascular disease or any clotting that they have? Do they have a hypersensitivity to heat or cold? This is not your cold. Remember, your cold starts at 39 degrees. And so, unless you're doing, well, even your ice bath is probably still going to be 30, high 30s. But remember, you never ever go above 110. So that they're making this hotter than it used to be. So your hot tubs when you go in are somewhere between 102 and 104. This is really hot. And I don't even think our tap water goes that hot. I don't know. We'll have to see. But the other thing, as you're practicing this afternoon, what I want you to think about is if you are not very efficient with your timing, and so you think, okay, well, Mr. Jones is coming at 1, and I'm going to be efficient, and I'm going to fill up my tubs at 1:45, and you fill it up at 100 degrees, and you fill it up at 64 degrees, what's that temperature of the water going to be in 15 minutes? It's going to change. And so your hot water is going to get colder, and your cold water is going to get warmer based on room temperature. So take that into account. Keep your thermometers in your pools. So right at the bottom so you can look, and if you have to add cold water or add hot water, you do it. You just want to be able to submerge the body part that you're trying to treat. So very, very commonly we treat arthritis, carpal tunnel. You could do a subacute or a chronic ankle sprain to try to get rid of some chronic edema, but you're only treating dependent extremities. Okay? Questions?